know and I believe and I trust is well with you. Name is Nortey by nature. Took a couple of weeks off. Yeah, I lost my sister. But I know she's in a good place. And you are definitely in a good place, 99.7 FM. And guess what? He definitely always makes a way. So some call it a frequency, I call it a family. Some call it a promise, I call it a program. Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. And like I said, he will make a way.
Joy 99.7 FM. Joy 99.7 FM.
You've got this in control, and now we know that you made a way. When our backs were against the wall and looked as if it was over, you made a way. And we're standing here only because you made a way. Lord Jesus, you made a way.
Now we're here, looking back on where we come from. Because of you and nothing we've done to deserve the love and mercy you've shown. But your grace was strong enough to pick us up, and you made a way. When our backs were against the wall and it looked as if it was over, you made a way. And we're standing here only because you
Joy
made
99.7 FM.
a way.
When our backs were against the wall,
When our backs were against the wall
and it looked
and it looked as if it was
you,
over,
Jesus, you made a way.
made a way.
Oh boy.
Standing here today,
And we're standing here
only
only
because
because you made
for your
a way.
goodness. You cause walls to fall with your power. You perform miracles. There is nothing, oh no, that's impossible. And we're standing here only because you made say
You move mountains.
You move mountains.
You cause walls to fall with your power.
resurrection power,
Perform
Jesus. Perform
miracles.
miracles.
That's right, 99.7 FM.
And we're standing here only because you
Truly he makes a way. All right, done that. Back to the business of the day. Today I want to take a look, a deep look that should help us understand the menstrual cycle. What is it? What actually happens to women during this period? Is it just a flow? Is everybody going through the same thing? Should we have a basis, a justification, a validation to compare? And what do men know about this as well? In the studio with me, a very good friend of the program, Dr. Michael Macarthy, CEO and consultant obstetrician gynecologist with the Sinel Specialist Family Hospital in Tema Community 6. Boy, they've gone through a cycle. They've gone through changes. Last month, I was unable to join them and feature them for their 40-year anniversary. But he's here now. We're talking menstruation. If you have any questions, concerns, we're live on Facebook and YouTube. And I will also activate our WhatsApp is activated actually 055 11 11 997. Dr. Macarthy, my brother.
Hi.
Great to see you.
Yes, great to see you too.
My
condolences to
you.
You.
We are in his hands. We are in his hands, and she is in his hands. So he will make a way.
Amen.
Right. And I'm glad and happy to be and humbled to be back in the studio, and great to have you. Sinel Specialist Family Hospital. Wow. I know last year we lost Senior Macarthy, your dad.
Yes, about a year ago.
Exactly. And you've unleashed, not launched, unleashed
creative forces.
Just tell us a bit about what you've done your 40th anniversary. And then you've done some new things. Just quickly, we'll get back on that later.
Yes, I mean, this is 40 years anniversary, 40 years of legacy by Dr. T.O. Macarthy, the late Dr. T.O. Macarthy.
Daddy dearest.
Yes.
Wow.
He was awesome. He was the first to do laparoscopies.
Wow.
In Ghana. Yes, in Ghana many years ago. He was the first to, maybe one of the first to bring an ultrasound machine.
Wow.
And that was a novelty at the time.
No.
He was active in doing pap smear, cervical screening. He was probably one of the first to set up a hospital that was dedicated to women.
Wow.
And I mean, he was a pioneer, and we have built up on this legacy. I like the way you put it, unleashing creative forces.
That's right.
Yes, I mean, when you get to Sinel as the Specialist Family Hospital, you see the creativity, you see the beauty, you see the expertise coming to life.
Wow.
And this is the kind of thing that we need in Africa, so that we can give better health care to. Now we're not doing only women or just women, we are also taking care of the entire family. Well, when you take care of a woman, you take care of the entire family anyway.
You're like MTN now, eh? Everywhere you go.
Not everywhere you go, but the entire part of your family, your children, your husband.
Congratulations.
Everybody, health maintenance, and wellness, and so on.
Right. Congratulations.
Thank
you just heard speaking Dr. Michael Macarthy of the Sinel Specialist Family Hospital, and they've done a lot. I will do a focus on them and the changes that he has unleashed, right? And it's just totally awesome to have you today. But today we've chosen to talk about the menstrual cycle, and we want to help people understand the menstrual cycle. Now, to many people, it's like, oh, but Nortey, this is basic. But there's a lot of misinformation and ignorance out there, even amongst women. Am I right, Doc?
Yes, I mean, even women who go through menstruation have challenges understanding the correct things. It's worse with men.
Okay.
I mean, men virtually
like Lexus Bill, who's sitting here, right?
Yeah, I don't know what he understands. I'm sure he's very well informed. I mean, I trust his judgment.
Lexus.
So I'm sure he's extremely well informed in these matters. But a lot
menstruation
of men,
is not personality profile.
It's not personality profile. But I mean, it's important for men also to understand what is going on with menstruation. Menstruation is not just the days of bleeding. I mean, there's much more to it.
Okay.
In fact, I advocate that women should have a menstrual app to track their menstrual periods.
Right.
I mean, years ago, about 10 years ago, I wrote a book.
What's it called? Menses?
No, I wrote a book on menstruation.
You did, you're right.
And part of my book, it has a calendar that you can use a pen and a pencil to mark what's going on and so on. I mean, that's outdated.
That's
last
outdated. Century.
Now we are using apps to monitor our menstrual cycles.
Okay.
And I encourage women to have good apps to track their menstrual cycle. Not just the women, the men should also have the same copy of the app to track what is going on. But we'll talk more about that.
All right. If you just joined us, 14 minutes past 14, right? 14 minutes past 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. Don't make it naughty. It is Nortey by nature, not naughty by nature. But I'm in the great company of Dr. Michael Macarthy of the Sinel Specialist Family Hospital, and we're seeking to understand the menstrual cycle, not just what flows or what doesn't flow, what hurts or what doesn't hurt, the whole 360, right? And he's making a point and underscoring and emphasizing that men also need to know about these things. And I know typically when we do this, the men start off with the WhatsApp messages and the phone calls. They think they are being 419 on some of these things. So it's good to know. And stick with us. We're live on Facebook and YouTube. And shortly we'll activate the phone lines as well. Our WhatsApp is 055 11 11 997. You're welcome aboard Ultimate Health.
Joy 99.7
Right, Doc. So we know averagely monthly a woman will go through this cycle. But let's get to basics. What is the menstrual cycle?
Wow, that's a huge question. And that's
what they pay me to do, ask huge questions.
Yeah,
and
huge
then,
questions.
And then relax.
And then you sit back and relax.
Yeah. Mm-hmm.
And that's a question that women are going through for about 40 years of their life, from the time they have their first menses to probably menopause when they have their last menses. First menses could be 9 to 12 years, sometimes up to 18 years before you can have the first.
These days, the girls are starting earlier. The menarche is dropping.
That seems to be the case.
8, 9 years old.
Yes, it could be that early.
Right.
But it could be much later also. So usually by class 5, 6, Form 1, Form 2, thereabout, you start having this, and that's why it's important for schools and teachers also to understand what is going on at that time.
Okay.
So that the appropriate education, assistance, help, can be given.
That's a very important point.
No, it's crucial. I mean,
Schools
my wife
should
runs
know
a
about
school.
this, right?
Yes, my wife runs a school, and she has
the
sessions.
Vine
Christian School
That's
and
right.
Vine Christian High School, and she has a fantastic way of taking the girls and the boys in a different session, but takes the girls in one session through what to expect, so she starts this before they are supposed
you
to be
prepare
due.
the girl
and yes, tell them what is going to happen
for this
how
monthly
it is,
cycle or
how
ritual.
to keep your pads, how to ask for help from teachers, things like that. So when things start happening to the classmates and so on, they are not too confused and they're not too distraught, So that's awesome.
Right, Doc, it's great you've brought this up that schools should know, but of course parents should know. This preparation for this biological milestone, right, where now you start to shed off cells, blood, and so on and so forth, according to a set given cycle. You're talking about schools having the knowledge and the capacity to prepare young girls and support them. What about parents? How would you? I mean, you're a specialist in the field. How would you rate the capacity across board? I'm sure you see different social levels, right? But generally, are parents, and I'm not just talking about women, prepared for these critical steps?
I think it's difficult for most parents.
Right.
It's not as easy. I mean, I'm a gynecologist. I've written a book on menstruation, so I don't find it too difficult.
WAFAN World Cup.
Yes, I've taken it very seriously. I mean, I probably have more experience in talking, not experience real, but talking, but it's very difficult for a lot of parents to broach this subject because they are afraid that when they start talking about menstruation, then children are going to ask about sex, then children are going to ask about pregnancy, and children are going to ask about things that they are really not comfortable talking about, and so it's a bit challenging.
Great.
But there are strategies to talk to children about this. You need to use their bodily changes as you start seeing the
things
children
are happening
changing
to your body.
Yes, and say, hey, what's going on here?
Right.
I see your breasts are growing. I see you're getting some pubic hair. I see you're getting some.
You say this to your daughter.
Spurs. Something is not smelling very well here. And this must be your armpit. Okay, so what do we do? And so on. And use those real life situations to start to talk realistically about the situation. You don't need to give textbook information. You just need to give basic, straightforward information that fits the age and the understanding of the child.
Great stuff. 19 minutes past your hour of 2 on Joy 99.7 FM. How did you introduce the topic, or let me say it this way, how did you avoid it? What was the toli you told to avoid talking about it when your daughter seemed to be bringing it up? Not just because of her, but maybe because of a classmate and so on and so forth. What are the consequences of early development? All your peers in class have not started, and you have started. What are the consequences, psychological and physical, of late development, right? You've seen other people, they are now talking about pads and other things. As for you, Sakura, nothing happening. This is why I brought Dr. Michael Macarthy of the Sinel Specialist Family Hospital into the studio. We're talking about and seeking to understand menstruation or the menstrual cycle. It's a big deal, and we're going boot for boot, blow by blow. And you are welcome on WhatsApp 055 11 11 997. We're live on Facebook and YouTube. The program, as always, on a Sunday afternoon, is Ultimate Health, your ultimate guide to healthy living. Right, I've got this on my WhatsApp from Keys in Nigerian Ghana. He says, my sincere condolences, many thanks. Nortey by nature. This one says, great discussion for you and Dr. Macarthy. It's been ages. Anyway, let me ask, is it possible for a woman to go through 3 different cycles in her life? That is 35, 28, and 25 days respectively. I think you're talking about your cycle duration or the gaps in between. Please accept our condolences. God will strengthen you and the family. May Sister Soul rest peacefully with the Lord. This is from Habi in Bolga. Thank you so much. Nortey, no, this is Kojo. Hi, Nortey. What's behind the menstrual cramps among young girls beginning to menstruate in recent times? Ernesto Indodua seems to know there's a trend amongst young girls in recent times. I don't know whether it's restricted to or localized.
I don't think it's recent times. I think it's been
right.
Going on.
Okay, Doc will speak to that, Ernesto. Hello, Nortey. I bleed heavily these days. I've had a scan done and everything is normal. I am 41 years and don't know what to do. It flows heavy as if a tap has been opened with clots. What do I do? This is from Sylvia. Doc, let's note that.
This is a very important one.
Very important one. Okay, heavy bleeding with clots. She's 41. Good afternoon, Nortey by nature. Kindly have my condolences. In case you remember, some time ago when your mom used to run the clinic, I came to work there briefly and stayed over. Just want to know if it's Nee's mom. Yes, that's my sister, Belinda. I know her very well because I used to take care of Nee. Her name is what I don't remember. My condolences again. This says Zet in a Queteman. Okay, right. It's a small world, but we are alive and we thank God for that. And we're talking about the menstrual cycle with Dr. Michael Macarthy. So the one about the 41-year-old who says, I bleed heavily these days and it has clots. You wanted to say something on that?
Yeah, it's a very important thing. 41 is an important age. We said when menses usually starts, when does it usually end? Ghanaian women averagely 48 years, could get 50, 52 in some people. So 41 means that she's getting close to menopause.
Okay.
And around menopause, you start having some of these problems.
Okay.
You can actually have excessive bleeding, have change in cycles. You can have different lengths and so on and so forth.
Okay.
The important thing about excessive bleeding with a normal or seemingly normal ultrasound scan at 41 is that there may be endometrial hyperplasia, which could lead to endometrial cancer.
Okay.
And so this is important. You know, a lot of people think that endometrial cancer is for postmenopausal women. No, it's not. You can get endometrial cancer before menopause.
Right. So what you're saying is that hyperplasia, then you're talking about abnormal tissue.
Abnormal tissue, which is not yet cancer.
It's not yet cancer.
But can develop. And so we need to diagnose endometrial hyperplasia. So hyper is increase and plasia is growth. So you have this situation where you have increased growth in the endometrium, which is abnormal. In the normal cycle,
the lining of the uterus.
Yeah, the lining of the uterus. Normally, it grows a certain thickness, and then there's no pregnancy, and then it comes out. That's menstruation, you know. But sometimes in endometrial hyperplasia, it grows much, much thicker.
Right.
So this growth is abnormally abnormal, if I could put it that way.
And therefore, when you shed it, you're
bleeding a lot.
Much, much, much more.
Yes, and she's older. If this happens in a teenager, it's probably not endometrial hyperplasia because at that age she may be having the thickness but no abnormal changes.
Right.
But abnormal changes in those older.
Okay, great stuff. You saw how Doc went about it. That's why I bring in the top-notch practitioners, right, and specialists. You see, he noted that she has a normal scan,
Yeah.
right, heavy bleeding, and then he took into consideration her age and has hit a probability that needs to be investigated.
It may not be. I mean, she
It
should
may not
be
be
scared that
right,
we're not diagnosing
right,
her
right.
on radio.
But that's why I'm going through the
Yeah.
steps you took to actually capture what I have read out and what she has shared. Right? Again, take note of this. I forgot if it was Sylvia, but it needs to be followed up properly and by the requisite or appropriately qualified specialist. Okay. Right. Somebody was saying that of late or in recent times, young girls are having cramps. People are galloping ahead of us. We haven't put the fundamentals down, but they are there and they are saying the fundamentals have changed. Is there anything like that you are aware of, that there's a change in these presentations over time?
No, I think there's much more awareness now. There's more social media. There's more information. And there's a bigger willingness now to talk about some of these issues. So it appears as if some of these things have increased. I don't think they have increased. I just think that the people are now talking about them more often. Yes, as a young lady, you can get cramps early on. Yes.
Okay, great stuff. Remember, we sought to understand the cycle. You are also all galloping ahead to deviations from what should be the normal cycle. It is important and essential, indeed non-negotiable, for us to understand what the norm should look like. Doc has said to me that every woman is somewhat unique or different, but there are some normal things we can talk about. Do bear with us as we go through that phase, and then we will get to these deviations, because already the flow has started on the WhatsApp. I'm already seeing I'm 40, but I've stopped menstruating. I'll read those in a sec, right? But allow Doc and I to do some polling station work. And get some stuff done. Right. Yeah. So what is happening to you? You are shedding something, and you are shedding it according to some set biological clock or cycle. Can we just go through that?
Capture this in 60 seconds. Right. So in a normal cycle, this is a whole cycle, averagely 28 days, but can range from 21 to 35 days. Right. And the endometrium is built up at the beginning to get ready to receive an egg. Somewhere like halfway through the cycle, the duration of time. Right. If there is no pregnancy, then the system starts to break down. Okay. And then at the end of the period, say 21 days up to 35 days, the lining will start to come out and will shed. Anywhere from 1 day to 7 days is probably very normal. Okay. And this is how normally it goes. Okay. During the cycle, there are other symptoms, like in the 2 weeks or 1 week before the actual flow of blood. There may be different symptoms of bloating, breast tenderness, irritability. And
that's the PMS.
And so yes,
the
could be premenstrual syndrome.
We
Those
talk
who have
about.
got it that severe will be a syndrome. Okay. And so on. And within this cycle, some of the times are such that you could actually achieve a pregnancy, and some of the times there's probably no risk of pregnancy.
The proverbial safe period.
Well, it depends on what you want to say safe about. So if it's a sexually transmitted infection, you're not safe in any period. Right. If it's a pregnancy, well, yes, but remember that even though we've spoken about the norm, there is deviation from this norm in one woman over her lifetime. Right. And so one of the text messages was that, can a woman have a 35, a 28, and a 25-day cycle? Right. In her lifetime? Yes. The cycles may change. Okay. Sometimes pregnancy just resets the whole thing. Okay. Sometimes body weight is increased dramatically, and so the type of the cycles will change and so on. So yes, there could be variations in the normal for you, which is still within the normal. Right. And that is why for a lot of women, and this men need to understand, for a lot of women, menstruation can actually come as a surprise. They're expecting, it's on this date, and then it comes 2 days earlier. All right. Of course, but they feel some different symptoms. It seems to become a bit earlier. So the cycle has done you Sulia. Exactly. Wow. And that can easily happen. For some women, it's like clockwork, regular. So if you see a woman who has accidentally soiled herself and things, that's the nature of the game. That's the nature of the game. It's not a problem. She should not be shamed. It's just an accident. I mean, men who are older, who have prostate problems, can also pass urine accidentally. Is that a problem? I mean, it's a health issue.
this type of equalization. I like this type of equalization. Men, don't be gloating. You too, we could get to a point where you need pampers or pads, right?
Yes.
So stand on your chair and listen up. This is Ultimate Health on Joy 99.7 FM with Dr. Michael Macarthy in the seat and me, Nortey by nature, asking all the down there below sea level questions about women's cycle. It's a serious thing. It is programmed to happen. It is important you understand your cycle and any possible or potential deviations from this cycle. That's why we're in the studio. That's why it's Sunday, but we are talking about it seriously. And we pray we have your attention. Lots more activity and flow on my WhatsApp, which is 055 11 11 997. Grateful for that. I still have a very calm-looking Lexus Bill sitting in the studio. He's revving up for the what's it called? The family quiz, And so he's chewing and doing all sorts of. He's wearing some Kwa Lobite black and white, but he's still our very own Lexus Bill, right? And he's learning. I'll ask him a couple of questions before he quizzes other people. Right.
We'll ask him questions on menstruation and see whether he can answer.
Yes. Why any side view say? All right. So if you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. This is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. Right, Dr. Macarthy. So your body and your system releases an egg. You must be a woman, okay? Get it straight. You can't fiddle with that. You must be a woman. Your ovaries release an egg, and then the uterus prepares to receive that egg. So it grows a certain lining and receives that egg. Depending on whether that egg is fertilized and therefore there's a viable pregnancy, it will do other things. If the egg is not fertilized, then that egg and the lining and all the kominini will be shed at a particular time. That's what we've understood, right? And
just with a little bit change.
Okay.
Maybe this is a question we should have asked Les's, but we will not ask him.
Okay.
We'll answer the question.
Right.
The issue is this, that the egg actually never gets into the uterus.
Okay, great.
Okay.
Because
the egg is usually just around the ovary.
All right.
So the ovary releases the egg, and the egg stays in that environment at the end of the fallopian tube around the ovary, waiting for fertilization. If it is not fertilized, it disintegrates.
All right.
1 to 2 hours and it's disintegrated and disappeared from the body.
Right.
This is really important.
Okay.
And then the endometrial lining comes out on its own. It doesn't come out with part of the egg and everything. And we need to understand that.
Okay, great.
You know.
All right.
And if, however, there is fertilization at that point, it is the embryo that ends up in the uterus.
Okay, right.
And then that goes on with the pregnancy. So it's not really the egg and part of the egg that are causing the problems during menstruation. By that time, the egg is long gone and disintegrated.
I'm tempted to say exactly.
Exactly.
Exactly. Right. Thanks for the expertise and the specialist clarification. Very, very important. Okay. And so the woman goes through this, and we mentioned that women or girls are starting this earlier because they are healthier, conditions, their nutrition and all that has changed. So yes, if your system is healthy, then there is a likelihood that there'll be this shift in the menarche, which is your first period. Or is period the right word, Doc?
Yes, fine.
All right, period.
All
right.
Menses, menstruation.
Right. Okay.
Yes.
I was scared you might correct me again. Right.
No. You're perfectly right.
For being 3 known. All right. So your first period is your menarche. When it stops is your menopause, right? Or menopause has started.
Exactly.
Okie dokie, right? You notice there's men in there somewhere.
The men are there, solid.
Right. If you have any questions, concerns, share with us. WhatsApp 055 11 11 997. And the phone lines are active 0302 216 541. I'm expecting, Doc, I'm expecting a heavy flow on the phone lines. All right. So Abeku has just gone out for some. Okay. We're expecting a heavy flow, right? Let me read a couple of these messages before I get overwhelmed. This one says, since May 2017 to date, I have kept the app on my phone. I've been updating it all the time. The same cannot be said of her. I guess this is a man, right? Thanks for encouraging men installing the app too. I was starting to feel like a weirdo, right? You know, how some ladies see the app on a man's phone and wonder why. Hey, what are they doing on your phone? Nortey, please, I'm 40, but I've stopped menstruating. I've been to the hospital severally, but to no avail. This is from Pamela. Doc, note that. All right.
Right.
This one says, please, after 6 days menstruation, I still see blood twice a week. Please, my English is not good, so if I can speak in tree. Well, we get you. We get you what you're saying, right? She finishes 6 days of menstruation or flow, and she still sees blood twice a week. Let me see if I can deal with the flow. Hi, Mr. Host. I'm Kwesi Yeboah from Akimadon Ogda. A friend told me about her planning she went through afterwards. Her cycle is not flowing again. Not
maybe
too clear. Family planning, right?
Yeah.
Okay, so maybe she's stopped the family planning and she's expecting her cycle to resume. That's another key thing we need to get to talk about later. This one says, good afternoon, Nortey. My condolences to Doc. Okay, that's about your dad. His father was my doctor. He delivered my daughter and in 1984 when they were in Committee 1. This is Oye in Athenia. Hey, Oye, you haven't missed me. You'll be like that. Alrighty. Kindly ask doctor. Kindly ask doctor. My cycle is 26 days. Is it normal? And how do I calculate my safe and unsafe days? Na in Tema is taking us into territory which is familiar to Doc. Right? This one says, what is my safe period for sex? What is safe period for sex and not safe period? Hello, Nortey. Please, how about someone who after some time only menstruates after every 6 months? Okay, that's a good one. Doc, you see what I said about the heavy flow? This is what's up.
Yes.
Hello, Nortey. My condolences for your loss. Thank you for this topic on men's cycle. All right. I guess it's an abbreviation. Men's cycle. We can't talk about this enough. All right. And then she corrects it to menstrual cycle. Okay. Yeah, we're going to be talking about this a lot. All right. So, Doc, somebody says something about menstruating only once or so every 6 months. Is that also something that happens?
Yes, so this is a challenge that the woman is facing. This is not the normal.
Okay.
It's too long to have a period cycle that is 6 months. So she needs to see her doctor and try to find out what's really happening and give her an adequate explanation. Okay,
right. In this 6 months of silence, if I can call it that, in quotes.
Yes.
Does it mean she can't get pregnant?
It's possible that she can't get pregnant. She may not be ovulating, and that is why she's getting this very long cycles. Okay, that could be the reason. She could be on a medication that is causing this, or her ovaries may not be working. Yeah.
Right. I'm still suppressing or postponing the questions on safe and unsafe period. Right. We've got it coming several times. And very soon we'll be called to the Supreme Court. Right. This one says, my cycle is 26 days. No other information. Is it normal? And
yes.
It's normal. All right. Okay. 9 Tema. It is normal. Okay. You have our blessings. Right. But she also brings in the proverbial safe and unsafe period. People have plans. I'm telling you. Right. Good afternoon. My condolences. This was about your dad and so on and so forth.
Yes, thank you, Oye. That was Oye. Thank you so much. And I'm happy that she delivered in Sinel
in 1984.
1984.
Okay.
And that was 38 years ago. So this child must be 38 plus.
Okay.
Maybe her children were also... so we get a lot of these where the children born in Sinel are coming into Sinel to deliver as well.
Right.
So that's nice.
That's brand loyalty.
So thank you so much for your condolences.
Yeah. My mom is alive. She's 84. She's a retired midwife. My dad, we lost him in 94. He was a gynecologist, obstetrician gynecologist. So he have a lot of these stories as well. I have a caller on the line. Hello.
Hello.
Yes, good afternoon. Who am I speaking to and where are you calling from?
Afternoon. My name is Emmanuel. I'm calling from Ada.
You're calling from Ada, Emmanuel?
Yes, please.
Okay, please go ahead. Share with us.
My question is, from the first day of the menstruation or the period, when exactly will a woman get pregnant? Which from the first to what date will a woman got pregnant?
Let's take that again. From the first day she starts to flow.
You started the menstruation.
I know this is a Mansu question. Which Mansu, baby? Oh. All right. Right. He wants to know when she flows, right? When can she get pregnant? I have another caller. Let's hold on to that. Hello, good afternoon.
Good afternoon.
Hi, who am I talking to?
Monica.
Monica, you're most welcome. Everything okay?
Yes.
All right, share with us. What's your question?
Yeah, my question is, can you menstruate without ovulation?
Can you menstruate without ovulation?
Yes, you can menstruate without ovulation.
Mm-hmm. So how would you know? I mean, since without ovulation you don't get pregnant, how would you be able to tell whether you're ovulating with your menstruation?
You need to do some tests. You need to test to see whether you're actually ovulating within those cycles.
All right. Okay. Right. She's having a full consultation there, right? Abeku has abridged that. Another caller. Hello.
Hello. Good afternoon.
Good afternoon, sir. What's your name?
My name is Brother Anna Jr. I'm calling from Pokomi Saba.
All right, Brother Anna Jr.
Yes, please.
All right. Please share.
Okay, great discussion you people are having today. My question is it true that the diet or food the ladies eat affect the cycle? Does it have any impact on the cycle process?
Okay, does your diet have an impact on your menstrual cycle?
Not so much.
Right.
Not so much. I mean, we won't get a lot of change directly resulting from diet. No.
Okay, right. I have another caller on my line. Hello, good afternoon.
Good afternoon.
Hi, who am I talking to?
It's Fidelia.
Fidelia, right.
Yes.
Where are you calling from?
Adenta.
Adenta, you're most welcome. What's your question or concern?
I want to know if there's PCOS can be cured.
PCOS, polycystic ovarian syndrome.
Yes.
If it can be cured.
Because I've been taking medicines and I've been bleeding still.
Okay, I'll hand over to Doc. So stay tuned. Thanks for tuning in. Stay tuned for a response, okay?
Okay.
And thank you so much for sharing with us. Ultimate Health on Joy 99.7 FM, 41 minutes past the hour of 14:41. Hello, good afternoon.
Good afternoon. This is Oye.
Oye from Afenya.
Yes, please.
Today you didn't invite me. It's okay. Share with Doc.
Yes. Tell Doc that my daughter is turning 38 this 8th May, Mother's Day.
Wow. Which means she was born 2 years after Sinel set off on its journey, right?
Yes.
Great stuff. Thanks for sharing, Oye.
Thank you so much. Congrats to you. And happy birthday to the lady.
Because I'm not fair caller, Oye has dogged me for Michael. No problem. I take it like that. Doc, we have quite a lot of questions, right? This lady, I think Fidelia, who's treating PCOS, polycystic ovarian syndrome. What's that? And she's asking, can it be cured?
Yeah, the polycystic ovary syndrome is something that's going on in her body.
Okay.
Has some genetic basis, has basis in her endocrine system.
Mm-hmm.
And so it's not just about her menstruation.
Okay.
It's about other things in her body as well.
Right.
And normally PCOS will last from the beginning of the menstrual time all the way through her lifetime.
All right.
And so it's not a matter of curing the problem, but actually managing it over time.
Okay.
And making sure that you can prevent some of the issues like the abnormal cycles that she's having,
right?
The fertility,
right?
Diabetes, hypertension, endometrial cancer.
Okay.
These are the biggest issues with them.
So your specialist or your doctor will be helping manage these things.
Have to manage and we shouldn't have the idea that, now when I take these tablets, then I'll solve PCOS.
Okay.
You may be solving maybe your menstrual problem.
Right.
But PCOS, which is the root of the menstruation problem,
right,
is still sitting there.
It's still there.
So you remember that, PCOS is still there. So the other things that it can cause, I need to check out for them.
Okay. Then that means, and it requires very good communication with your doctor.
Yes.
To understand, right?
Yes,
because when our patients don't understand, they go shopping elsewhere.
Yeah.
And sometimes this complicates the picture.
Sometimes they understand.
Right, but they're in some
but
denial.
They want a different answer.
Okay. And some people are willing to sell them that different answer.
Well, I don't know, but they want a different answer that says, oh, it's cool. You take this medicine, you'll be fine.
All right. Okay.
But when you give them too much detail, then they want to say, this looks deadly. I don't want this.
Okay.
And then it becomes a challenge.
Great
yes,
stuff.
Exactly.
Right. You're hearing that from an experienced consultant obstetrician gynecologist, Dr. Michael Macarthy of the Sinel Specialist Family Hospital. We're taking our time and we will come back to this over the weeks and many other things, right? I've got him locked down, okay? He's not just here by chance. This is accidentally on purpose. Right. Our phone lines are active 0302-216-541. Those are the healthy buttons to push to have a slight, small, brief consultation with the specialist and then get informed and hopefully transformed.
Joy 99.7 FM.
Right. Let me try and read out a couple more. Hey, this one, somebody has spelled my full name. Oh, wow. Mr. Alfred Nortey Dua, please ask the doctor why of last you see a young lady of 15, 10, of late, I guess, 10, 13 years old menstruating. Are we safe with the food they are eating? Douglas from DC. So the diet and menstruation comes up again. He's saying he understands that you're seeing younger and younger girls starting their menstruation, and he thinks it has something to do with the food. Can we address that?
Yes, it's fine. I mean, 15, 13 is fine. That's the time I said it was. Yes.
Yeah.
And Nortey, you also said it right, where you said that as they have a better nutrition.
They're healthier.
Earlier. They are healthier earlier on. And it also has to do with body weight. So if their body weight starts to increase earlier, then the cycle triggers more earlier to start off.
Okay. Yes. Right. Please, my cycle is every 3 weeks after having my second son, who is almost 6 years.
21 days. Yeah, so 21 days is fine.
It's fine. Okay. All right.
The only thing about this 21 days is that she's going to have her ovulation very early in her cycle.
Okay.
By like day 7. So if this woman has a period length of about 7 days, she will probably not get pregnant. Not because she's not ovulating, but she may not be having intercourse during her period.
All right.
And so that can be a challenge for this one. She needs to note that.
Right. She needs to know and be helped to chart her cycle properly. All right. Especially if she's looking for a child.
Yes, and have intercourse earlier.
Charlie, I didn't have homework.
It's a really serious homework.
I saw Lexus Bill writing. Hey, Aquia Shack. Good afternoon, please. I'm 25 years old. My period lasts for only 2 days. Is it normal? Aku from Bechile.
2 days can also be normal. If that's been what you've been having, it's fine. If it has changed, then we can check a few things that may be the cause of this.
Okay, I have a call on the line. Hello, good afternoon.
Good afternoon.
Right. What's your name and where are you calling from?
Monica again.
Monica again. We left something out, right?
Yeah.
What would you leave out?
About this endometriosis. Is it surgically managed or is medically managed?
Endometriosis.
Yes.
Doc, hang on a sec. Monica, you called that earlier.
I called earlier.
Was that the one about the PCOS?
No.
No, okay, right. So you want to know about endometriosis?
And that's not all.
Okay, shoot.
Yes. Also, whether the use of this emergency contraception can affect your cycle.
Okay, right.
Thank you.
Have you been using this?
No, but I have friends who do that and they have challenges.
Okay, right. So how is endometriosis managed, and does the use of this emergency contraception affect or modify your cycle, cause problems? I have another caller on the line. Hello, good afternoon. Ultimate Health.
Afternoon. This is I'm calling from Bato.
Right, you're calling from Bato. I didn't get the name.
Hayford.
All right, Hayford. Right, go ahead quickly.
Yeah, please ask the doc for me whether the food that we are taking can have effect on the menstrual cycle.
Okay, we're back to food again. He's answered that, right? Your diet and menstrual cycle, right? Anything you want to say on that so that we kill it once and for all before going to the Supreme Court?
No, I think the diet, yes, it makes you more healthy, so you're more likely to have your menses at a good time earlier, especially if your weight is more than 45 kilograms. That's when most people will start having their menses.
Okay.
And then but the diet itself doesn't have a direct effect on your menstrual cycle.
So your health status, your physical status is what we're talking about, which is related to your diet. All right. Endometriosis.
Yeah, endometriosis can affect the cycle. It can change things. It can cause intermenstrual spotting. It can cause pain. But she was talking about how it is treated. It can be treated both medically, either medically or surgically, depending on what it is, what the complications are, where it is, and what you expect to achieve from the treatment. So we should have a session on that.
And that's a whole book, not just a program. That's a whole book on itself.
I think she's probably confused because somebody is telling her that, we can use medication to treat. And another person is saying, let's use surgery to treat. And she's wondering who is correct. They are both correct. It depends on what you want to achieve as a woman. Are you achieving fertility? Are you achieving just pain relief? Do you have certain complications? So yeah.
Great stuff. And then I have a call on the line, but remember the one about the emergency contraception and the cycle. Hello, good afternoon.
Hi, good afternoon, Mr. Nortey Dua.
Yes, sir. Who am I speaking
to?
Good
afternoon. This is Sammy from Oyarifa.
Sammy.
What is the cause of ovarian cyst? Yes. And can it be cured?
Say that again.
The cause of ovarian cyst.
Ovarian cyst.
Yes. And can it be cured?
Okay. Right. These guys don't want the fundamentals. Hello. Good afternoon.
Hello. Good afternoon.
Right. Who am I speaking to?
Please, Joycelyn.
Joycelyn, where are you calling from?
Ebri,
share with us.
Please, I want to find out, at 48, the menses wasn't regular. It will come and it will go off and all that. Then 49, it has stopped. But midnight, I sweat a lot. I want to find out whether there will be medication or what's the...
All right, 48, it was like stammering, testing 1, 2. Then 49, it stopped completely, but you sweat at night, right?
Yes.
And you want to find out. Okie dokie. Doc has nodded, right?
Thank you.
Right, okay. So, ovarian cyst.
Yeah, so ovarian cysts need to be treated. They could be treated surgically. There are indications and reasons why we want to treat them surgically. Some of them don't need surgery, and then we'll say, yes, those don't need surgery. So, yes, that needs a hospital visit and a specialist consultation.
A cyst is what? A growth?
A growth in the ovary, yes.
In the ovary,
yes.
Right, okay.
Yes.
And is a cyst normal?
Well, the ovaries can produce cysts as part of their normal function, and then ovulation occurs and so on. Could occur in early pregnancy. Some of the cysts are abnormal and they are growing abnormally, especially if the cyst is after menopause. That could be a cancerous cyst, which needs to be checked. Yes.
All of these need proper specialist investigation.
Yes. Then you could have them much younger as well, in their teens. Yes.
Okie dokie. I have another caller. No, one caller. Okay, right. Hello. Good afternoon.
Please, how are you?
I am fine, thank you. And you?
I'm also doing well.
Okay, what's your name?
I'm Alberta.
From Ningo. Please share with us.
Yes. Please, first, I want to find out if their facility, they take health insurance.
Okay.
And then the second one, is it normal, like for a 40-year-old woman, to have a menses, and then after the menses, 2 days after the menses, so we'll be seeing like drops of blood.
Okay. Right. Okay. Is it normal to see blood after your menses, age 40?
Yes. Some people get some spotting after menstruation, and that may be normal.
Okay.
But that may also be the sign of some other problems.
Okay.
Of the cervix, inflammation of the cervix, cancer of the cervix, endometriosis, ovarian cysts, uterine fibroids, and so on, especially in those who are older, about 40. So if this is when she's now started experiencing this symptom, she should see the hospital. Yes.
Okie dokie. Does your facility, Sinel Specialist Family Hospital, do you take health insurance?
Yes, we do health insurance. We do private mutual health insurance, and that runs very well.
Okay. All right. So that's covered. There was a gentleman who said, look, after the first day of your bleeding, when can you get pregnant? You started bleeding. What should he be counting? And what, should I say, pink sheet should he be taking if there's any contention or disagreement about this?
I think this has been a question. There's a lot of such questions on the WhatsApp page, and also these are the questions that people are always asking.
All right.
And it's a little difficult because the cycles vary from one woman to the other, and even for a particular woman, the cycle may vary from month to month.
Okay.
And this is why I advocate that just use an app.
All right.
Get your menstrual app. What a menstrual app does is that it takes records of your present cycle and your past cycle. So the more past cycles you have stored in your app,
so
and
it
if it's a very
collects
good
baseline
app,
information.
it gives you the information about yourself, and it starts telling you, predicting, especially if it's got some AI in it. It starts telling you when your next fertile period is, when it starts and when it ends, and it's as simple as that. So you don't need to go calculating and making mistakes.
Isn't the app putting you out of business?
No, not at all. It's helping us.
It's helping
us, yes.
Right. Okay.
Yes, because it's getting more information,
more
accurate
out
information,
there.
and you can help people much easier.
Right, and you can reach more people, right?
Yes.
And even people of lower levels of education or whatever, they just get into this. It does that.
So you don't need to get confused about your
so you endorse the
cycle
app
at all.
You endorse the app.
Yes, it must be a good one.
Okay.
I mean, yeah.
All right. Okay. I'm going to try and end by reading a lot of the WhatsApp, which is, like I predicted, a heavy flow. How did I dodge these ones? Okay. Nortey, I miss something, Papa. This one says, this is Oye Inafenya. She misses me, Papa. 419. Ha, you will not get me. All right. This one is not about ultimate health. This one says, still on the 6-month silence. Could it be menopause because I'm 50 to 51? The one who says
exactly.
Okay.
Exactly.
So it's menopause doing testing mic 1 2 1 2 1 2. Right. Good afternoon, Nortey. Accept my condolences. Accepted. Please ask the doctor for me. I have stopped menstruating, but I feel the ovulation pains from month to month. Clarissa Bigmus Wallace. Is that possible?
Yes, it's possible.
Okay. She feels the pains. All right. Okay. So it is possible. When Doc gives me a short answer, then I look at him some way. Please, I'm Agi. I'm 33 years. I experience severe pain when I'm getting close to menstruation. It could be for 4 or 6 days ahead or prior to my menstruation. And my main problem is that I have only 1 or 2 days flow. And it's just not a heavy flow. Please, is this normal? And my cycle is not always on time. 25, 21, 24, 27 days. It's just all over the place.
Yes, this is a bit irregular. Okay, 21 to 27 days, yes, and then pain before. So she may be having some challenges which are not directly related. Maybe fibroids, maybe Menses, endometriosis, things like that.
All right.
Yes.
Okay. Will a woman that has done tubal ligation still menstruate?
Yes.
Ernest Nabeka?
Yes. She'll still menstruate.
Capital yes from Doc Agbena. Right. Wow. Still flowing. Please, Nortey, my question has not been addressed. Nortey, I'm 40. I've stopped menstruating, but I have been to the hospital, but to no avail. Pamela, 40. Can she be premenopause?
Well, it could be premenopause, but she says she has stopped menstruation, so she's probably not having menses at all.
Okay.
So yeah, she needs more evaluation, AMH, prolactin, FSH, to see whether her ovaries have stopped working altogether.
Okay. Doctor, my deepest condolences. Thank you. This is from Dede in Maryland. Dede, hi. Don't fibroid cause heavy menstrual flow?
Yes, it does. It does.
Clots? Yes, I think we didn't mention that, but it does. There is fibroid. Therefore, is fibroid the same as endometriosis?
Not the same. They are not the same. They are very different things.
Is it true that fibroid can degenerate
during menopause? Yes, it could, but more likely after menopause, if you're having pain, degeneration of a previously known fibroid, it could be that this is a uterine cancer.
Okay, right. Amma and Joel, I can't see the images you sent. I'm trying to land and hand over to Lexis Bill. Hello, good afternoon. Please, is it possible to have a second dose of this adult biology 101 class? Definitely, you have several doses as prescribed. This is Pasolo in Sujani. Good, we're wrapping up. I want Dr. What does it say? Oh, come on. I want doctor's number and direction to the facility. Community 6, Tema. You can't miss it, as the UK people will say. All right? Ask for Sinel Specialist Hospital. Deepest condolences. And what does it say again? To the family. Oh, this is Martha Jansalutrot. Martha, great to hear from you. Yes, it is well. Nortey, my cycle moved from 29 days to 35 or 37 days. Is this normal? I'm 35 years old. Catherine from Tema. Doc?
Yeah, it could be. Could be normal. Could also be some changes in her body. She's also growing older.
All right. I'm listening to you live from Oyarifa. I thank God for his protection and favor in my life and my family. This is Charles from Oyarifa. All righty. Please, I delivered in January. I menstruated on the 18th. I delivered on the January 29th, and I delivered on 18th of March, but didn't menstruate in April. Is that possible?
It's possible. Commonest cause of not having a period is pregnancy, so you check for pregnancies. Also, this is just after a delivery ended, so it may just be that the system is getting back into cycle. So she should probably just do a pregnancy test. If it's negative, then she can just wait for a few more months and see what happens, especially if she's breastfeeding at this point.
All right, great stuff. We're out of time, and I have to stop the flow. Yes, I do have to stop the flow. Doc, with your permission, we can stop the flow for today.
I think yeah, we need to apply something, and then maybe we put in a tampon and then continue next week.
All right, great. This has been great, awesome flow, awesome information, and hopefully transformation as well with Dr. Michael Macarthy of the Sinel Specialist Family Hospital. He's here for us. I've locked him down, and we're going to do this in detail. Many thanks, immense thanks to you, Dr. Michael Macarthy.
You're welcome. It's been a pleasure being here.
Always great to have you, and so easy, so easy. I could do this with my eyes closed. But many thanks to my discerning listeners. Thanks for all your condolences and sympathy shared, and many thanks to my producer Abeku San Kofi. We'll be back next week with another healthy, easy to digest edition of Ultimate Health, your ultimate guide to healthy living. The family pop quiz with the pop dada himself, Lexis Bill, is coming up. I believe this is the maiden edition, and he's in black and white. My name is Nortey by nature. I'm out of here. It's been great having you and very therapeutic for me indeed. I hand over to Lexis Bill for the Joy FM family pop quiz. Take and stay. Don't go away. I'm out of here.
Can you send her my number?